One of my favorite dish.
Limited retaining.
Alright, so currently it's almost, I don't know if you can see it. Yeah, so currently it's almost 3 p.m. Monday, 13th of January. So now the plan is that I'm going to study for a couple of hours. So my exam is on Saturday, which means I have 5 days left to go over exam questions again and to revise certain topics. That's the plan now. Right now I'm going to do some previous exam questions. Then afterwards I'll do Anki cards. It's a bit later than I had expected. I was expecting to be done around 2:30 p.m. but it's 3 p.m. now. So anyways, let's get to it. By the way, if you're wondering why my face looks getting a call actually. I examensperioden eller du ved, det er før eksamensperioden. Okay, so it's dinner time now, and today we have one of my favorite dish. It's like a lamb chopped stew, and you eat it with bread, which is called roti in Urdu for non-Pakistani people. And so this is one of my favorite dish. You can say that's the perk of living at home. Your mom cooks very good food, and so you can see actually. I don't know. It looks like this. Yeah, it's one of my absolute favorites. So some people like to study while they eat dinner, but I'm a bit different. Like when I'm eating, I just want to eat. I don't want to do anything else. I just want to enjoy the food basically and watch something because I don't have time in the rest of the day.
Because I have to study, or I have to go to university, or I have to do something else. I have to meet up with friends.
So I'm always doing something. So the only time I can watch something, like watch some Netflix series or anime or something, is only when I'm eating dinner or maybe like having some lunch or something. So I wanted to share something interesting with you guys. So as I was studying, I'm just going over my like cardiophysiology previous lectures, and so I wanted to show you guys something interesting. This is an example of a normal artery. You can see that the lumen, which is the area between the walls of the artery, there is no occlusion, there's nothing that blocks this artery, meaning blood can flow freely through this artery. And so if we look at this example, you can see that the blood can only pass through such a small area, and all of this is occluded. There's a blood clot, which then leads to the heart not getting a sufficient amount of blood which it needs, because it can only flow through such a small area. And so then you'll have chest pain and you'll have difficulties breathing. So this is just an example of how a normal artery looks versus how a blood clot looks in an artery. And so this is just for non-medical people who ever wondered like how it might look on a microscopic level having a clot in your artery.
The next day.
Alright, so it's breakfast time. We've got fresh juice to give us some vitamin C to boost our immune system. We got avocado and eggs and toast. So pretty standard breakfast, and we got our, chai. as usual. So the usual breakfast. So I'm just going to have my breakfast, then afterwards I actually have to go to the barber today. My hair's getting a bit too long, so it's getting too crazy, so we just have to sort that out. And then probably go to the gym and then continue our study session. It's Wednesday today and my exam is on Saturday, so I have 3 days left to prepare. And actually right now I'm just going through my revision. I have done my actual preparation. This is just revising the preparation which I had done previously. So just going over topics which I think I should revise once more. So I had written them down during preparation that these are the topics I should go over when I'm close to the exam. So that's just what I'm doing right now.
Limited containing internal organs.
Alright, now it's time to get to the barber and fix this. But firstly I have to change. I don't know about everyone, I actually want to share this and maybe some people, if they watch this video, can comment below. When I go to the barber, I have a couple of t-shirts I wear that I only wear to the barber because I don't like having like hair on my collars and on my t-shirt afterwards. Even if when I wash the t-shirt, it still feels a bit itchy afterwards. So that's why I have t-shirts which I specifically wear to the barber. And I don't know if anyone else does it or if it's just me. If you do it, then comment below. I just out of curiosity, I always thought about it. Maybe it's only me, maybe other people also do. Right now while studying I'm having my favorite dessert, which is called kheer. It's a Pakistani / Indian dessert and it's actually my favorite. So basically right now I'm still solving previous exam questions. So currently it's just around 10:30 p.m. right now. So I actually had forgotten I had to go to the gym. Well, the gym is going to close in half an hour, so I just think I'm going to do a home workout today. Just like 20-25 minutes, just get the blood flowing. Lul efficiënt voor je celactiviteit misschien toch zo kan zien.
네, 익스로도 드렸는데요. 네.
Years later.
So I just wanted to quickly talk about today's exam. So it was 6 hours long and it's called Exam in Internal Medicine, Pathology, Anesthesia, Surgery and Patient Safety. So it's a very long name and it's, as I mentioned in some of my earlier videos, the exam is about basically whatever we've learned in the past 4 years combined into one exam, which is case-based exam. So it was 6 hours long and we had 4 cases. So the first case in my exam was about a thumb fracture. and what kind of treatment you would give. And also the patient had infection, so how would you treat that? What type of antibiotic will you give? What are the side effects? And what are the risks if you do not treat it? And how long do you have to get antibiotics for, and so on. So that was the first case. My second case was about a woman who had inflammatory bowel disease. Then you had to give like differential diagnoses. Actually, the second case was actually two cases. So at the end of my second exam question was another case, a second case about colorectal cancer, and so how you would treat that. And they gave us a long descriptions. We had to also, from the description, determine which stage the cancer was in. So that was also a very interesting, a very good case. Thirdly, we had a case about breast cancer. Also, that we had to understand what like stage the cancer was in based on the description we were given. So that also went really well. And the fourth one was actually really tricky. I found it to be quite funny. So they gave us a very, very long description of the patient. They did it in a very funny way, and they tried to hide some of the information. In that long description, they say that the patient has been smoking from the age of 15, and the patient's age at the time we were seeing the patient as a doctor was 62. He has been smoking for many, many years. They did not say that he had chronic obstructive lung disease. This is something we had to figure out for ourselves. It came because he had difficulties breathing, and so we had to come up with differential diagnosis and a plan of treatment and so on. But overall, I would say the exam went really well. I was really happy with how it went. I think I did really well on it. So let's see if the result kind of mirrors my experience of the exam.
Det er alt for gode.